Stella Kocovic
Yes.
Villacorta.
Yes.
Where's that last name from, that first one?
Montenegro.
That's where you were born?
That's where I was born. And
When did you come to the U.S.?
6 years old. In the 90s, early 90s with the Bosnian-Serbian war.
Mm-hmm. Did Montenegro get involved in that?
They were economically impacted.
Mm-hmm.
And we had some actual personal attacks, 2 bombings personally to our home.
Wow.
So, yeah.
Do you remember that?
I don't remember that. It happened at night. We were sleeping. One bomb was under the car, under our car. That one didn't go off. The other one was thrown at our balcony, rolled into our garden, and I guess went off there.
Was that collateral damage, or was your family pinpointed for this?
We were pinpointed. My dad was a business owner, and the Mafia wanted money for protection, and he told them no, and
wow,
that's how they. That's what they did. So, my parents, and they wanted to give us a better life. They wanted to give us the opportunity, and at that time they had 3 kids, and then when they came here and had the 4th, so I'm one of 4 girls, oldest of 4 girls.
All girls. And your dad's still alive?
Yeah, both parents. They live in Chicago, suburb outside of Chicago.
They talk about that event? That seems monumental, an explosion.
We've talked about it. We know about it. I wouldn't say we talk about it, I mean, it's been brought up as to why we came here and our story. But they found out who did it, and it's all kind of unraveled, but
wow.
It's not something they hold with them. We've moved forward and we've created a great life here, and they've created a great life. They've given us everything here. And
you've given yourself some stuff, right? You went to medical school?
Yes.
Where did you study?
I was at Nova here in Fort Lauderdale.
And what type of doctor are you?
Internal medicine.
Internal medicine. And let's talk about healthcare, because I've been paying my own healthcare for decades, and it's a lot of money. It's something like $2,400 I pay. I don't feel like I ever use it, right? In fact, I go to like a natural medicine doctor, or I do something like that and I'll pay cash. But I guess I have it just in case something catastrophic happened. But is that system broken? Feels like it to me as a consumer.
Yeah.
What's
it
broken
feels like
about
it to me as a doctor too.
Yeah.
That's why I broke away from the system. There's so much that's broken about it. How do I put this? It's kind of like if you picture walking into a restaurant, right? And then you hand the menu to someone else, and then they decide what you're going to eat, and they decide how much of it you're going to eat, and they decide if the chef can put seasoning on your food. And then the chef is in the back, right? And he's trained, maybe he's a Michelin-trained chef, but he has an assembly line of people waiting, right? Oh, that's the other caveat is, by the way, there's a whole long line of people waiting. So you're going to have to wait a really long time to get your food, right?
Like a
so
soup
the chef,
kitchen.
yeah, so the chef is back there. His training could be exceptional, but he's got so many orders that need to come out that he's not even looking up. He doesn't know who you are. He doesn't know your name. He doesn't have time to get to know you or explain what the food is or what the ingredients are. It becomes an assembly line. You leave the restaurant, you feel hungry, you feel unsatisfied, you feel angry, and that's kind of that's my picture of what healthcare has become.
Yeah, well, that menu, on top of it sounds like, someone else picks the food, the chef doesn't get to do their skill, and then they set the price and you have to pay whatever.
Right, and that's what the healthcare companies have done, is they're controlling both sides of it, actually, right? So they're controlling, who you see and what we can order and what they're going to cover. And doctors are being pushed to see more and more patients. So it's becoming an assembly line type feel. And that's what's creating this whole wave of people kind of not trusting the system, not trusting doctors, because we're kind of roped in, right? I mean, we went to medical school to help people. We really did. This is not a profession where you're really making the way it used to be, like hand over foot money. It's not like that anymore, right? The big houses on Star Island are usually not doctors. It's actually probably Big Pharma or one of these guys.
That's right.
So
how has that changed? What did a doctor make, or what could they make, I don't know, 20, 30 years ago, and what's it like today? I
don't know. I honestly never looked into those numbers. I know that they were doing better generally, and now it's, I would say you can make a lot more money doing a lot more things than being a doctor. Right now, it's really more of a passion of helping people, of really making sure people are taken care of. And then what's really disheartening is, as a doctor, when you go through that, right? I've wanted to be a doctor since I was 5. That's all I've ever wanted to do. And I did so many things coming to this country to get there, pushed fought, like really tried to figure out the system. My parents didn't know the system. Over there in Montenegro, you go to once you leave high school, you go straight to medical school. There's no college. You just go to medical school. So when my dad found out I was going to college here, he sat me down. He said, listen, honey, if you need 4 extra years of training, I don't know if this is right for you. Like, that's how little he understood the system, right? He thought I just needed like 4 years of extra help to get in. So I really wanted to do this. And I went through the training and I came out, and I even left my hospital medicine training to do outpatient primary care because I wanted that connection with the patients. I didn't want to just treat them and discharge them and never see them again. And you're put into a system where you're seeing 20, 30 people a day, and you're given 5-10 minutes, if that, with a person who has maybe 5 things to discuss, and you can discuss one. It's reactive care.
And this is irrelevant whether it's someone working for a hospital where the employers are telling you how many to see a day, or it's your own practice, right? Same. I
think it depends. I mean, I've gotten rid of all insurance, so I do a concierge model. I've cut them out completely. I'm not in contract with anyone at all.
Wow,
I charge
so
an annual fee.
Show.
I run my own show. I write my own notes. My notes are the way I need them to be written, the way I want them to be written, the way that it makes sense for the patient. I send patient a summary after and say, this is what we discussed. This is your homework. This is what I want you to work on.
It's written for the insurance company?
It's written, right. It's written for the codes. They, if you want to bill a certain code, certain verbiage has to be in it. You have to click certain boxes, which is the reason that a lot of times you go see a doctor and they're not looking up because, not because they don't care about you, but because like there's 30 other people waiting and this note needs to be done so that it can be billed. And, it's just an entire system that you get trapped in.
So we'll get into your practice, but what does an average doctor, I don't know, whatever. I'm going to go see an ortho for my shoulder on Friday next week. How many... Typically, what do you think? What are they seeing in a day? How busy are these doctors? Because, I'm there for that window of time and I leave. I don't see the rest of it.
Specialists can see a lot more. Maybe 40, 50, depends on the specialist. Depends on the specialist. I know some derms that are up to 70 people a day.
Wow.
So specialists, because they're usually focusing on just that one thing, tend to run through a lot more people. They might have more staff that's helping. They'll have a PA or a nurse that's kind of seeing you before they see you, so then it shortens the time that they're with you.
Right.
It can definitely be 40 to 70 for specialists.
And what's the impact on care? Does it? I mean, I know it feels good when I get to sit with a doctor longer and talk to him. I feel better. I like it. Yeah. But what's the impact on care if you see a lot or don't see a lot?
I mean, I think the impact on care for me is really clear. If you don't have the time, it's like with anything. Right? Like even if any business, right? Pick something that you're passionate about or your own business, right? If you don't have the time to spend to do it, you're probably not going to get as great of an output as if you had that 1 hour, 2 hours a day to spend it. So it's the same thing. Like the input that you're able to put in is going to make a difference. So if you're sitting with a patient for 5 minutes, or if you're getting someone else to see the patient and you're reviewing that note, there's already things that could be missed. And then you're forgetting about the patient-doctor relationship, right? The connection. It's very rare that you can form a connection with someone in 2-3 minutes.
It's like a speed dating.
You need that time. You need the time. They need to trust you. And when they trust you, they'll trust your advice and they'll trust that you have their best interests at heart. With this system, with seeing 40 to 70 patients a day, I just don't see how that's possible.
Yeah. I've coached in my coaching practice a few doctors. One of them owned physical therapy offices, and it seemed like a lot of time in the office when I sat with the employees to see what they do was wasted on collecting from the insurance agency or from the insurance company, right? Getting bills paid, and also just getting them to answer the phone. There was a girl, I remember in one office, there was a girl's job all day was to call the insurance company. And the girl was explaining to me, no, I spend my whole day on hold. I just want to ask a couple of questions, but they intentionally, I guess, make it very difficult to collect for the doctor. Yeah,
that's an entire job. Like you said, it's an entire job in itself because of what it requires and the hoops you have to jump through and the letters that you have to send back and the notes that doctors need to add, supplemental notes to prove that this patient really needed this test. The amount of time that is spent doing that, the burden for the doctor, but for the patient as well. Mm-hmm. Right? Because now, you might be getting a bill and they don't want to pay the bill. And now you're mad at the doctor because it's like, well, they're saying I didn't need this test. Who's they?
Yeah.
They've declined tests that I've ordered, like simple, like vitamin D tests for my patients and sent them a bill for $450. And then of course the patient calls the office because who did they talk to? They talked to me, right? So I'm responsible. So it's like, well, you ordered this and they didn't cover it. I'm like, who's they? Like, why didn't they cover? Who are they to tell me? They didn't see you. They didn't talk to you, but they decided it's not covered. So now our office is dealing with, having to figure, this was before when I was in that kind of system, figuring out what can we do? Is there something on my note that can show that they need it? Do I have to adjust something? Can we talk? It's just not right.
It's a mess.
So
what does the insurance company, here's what I always think is, if there's an insurance company, they want to keep costs down, I would think, right? Because they don't want to pay out a lot. So that should keep my costs down as a consumer. But my insurance for my family, medical insurance, keeps going up. I'm spending tens of thousands of dollars a year on that. What's going on? Aren't they there to control the costs?
I don't know. I don't know where that money's going. It's not going to us. It's not staying in your pocket. And the system's not getting any better. So I don't know the answer to that question. I know that the costs are going up. I know that the doctors aren't seeing, any of that for sure. Patients are paying it, and
because
it's kind of despairing. I'm not sure. I haven't seen any benefit.
And the amounts that are being paid to doctors are going down for services.
There's a ton of doctors now that are dropping insurance. A ton that they're posting. I see their posts on social all the time. I'm just announcing, hey, I'm dropping insurance as of this date.
So as a consumer,
it's just not worth it.
An insurance customer, because I feel like I have to be, because what if I get a serious illness, or one of my kids or my wife, I have to have, because I don't want to pay $500,000 for some big thing, right? But I don't mind paying $500, $300, $800, right? I don't mind paying those sort of things. What's this final solution? Is there, I don't know, I don't even know anything about this. Is there catastrophic care? What's a solution for a consumer who doesn't want to keep paying all into this? And I don't mind paying cash.
Yeah, that's and that's kind of where we've gotten to now, even personally. So we have catastrophic care. It's going to come out to cheaper. You end up having higher deductible, so that if something happens, you're gonna pay maybe a larger amount, but you're ready to pay that. You say, okay, this is how much I'm going to set aside for that. Yeah. The rest of then the costs monthly are lower, and then the rest you pay out of pocket. So, I mean, we actually have that exact setup, and we had gotten, and I always tell patients, have some insurance. I'm not an advocate for having nothing, because things happen. Yeah. I mean, it happened to me. We had just dropped the regular insurance, and we were like in that boat of just like, I don't want to do this. I don't want to pay $4,000 or $5,000 a month for a family of 4. This is insane, or more. And we talked about catastrophic. There was a point where I was like, we don't need it. And Miguel said, no, let's get catastrophic. Got catastrophic. 6 months later, I got breast cancer. Wow. So it helps, right? Yeah. So I'm never going to tell someone don't get it. It helps.
What could that cost? If a woman gets breast cancer, what could that cost?
Oh, hundreds of thousands probably for those surgeries. At least that's what I saw on the bill.
Yeah.
What they billed out. Now, what you bill out doesn't always mean that's what you'll get paid. But at that point, you're negotiating with the hospital what their rate is, what their cash pay rate is. So
you had surgery? I
had surgery. I had bilateral mastectomy and reconstruction.
Wow.
About a year and a half ago.
And no chemo or?
No chemo. I was diagnosed very early, and since I did the bilateral mastectomy, I didn't have to do the radiation. So that was.
And the bilateral was preventative part of it, half of it?
Yeah, half of it was.
Yeah.
Right. So I had breast cancer on my left breast, and I just decided to do both. I didn't want to risk recurrence. I didn't want to deal with the anxiety of having to go back with all the scans and potential biopsies. And to be honest, that was more anxiety provoking than actually getting diagnosed. So, So back to your point though, catastrophic is good. I say have a catastrophic plan, so that just in case if it's something big, then that's going to kick in, right? Yeah. And then for everything else, you pay cash, and cash rates are pretty reasonable actually. It's just people don't think about. They think, oh, it's going to be really expensive, but there's even specialists that see insurance that see people that don't have insurance, and they have a cash pay rate for them.
Yeah,
like my endocrinologist has a cash pay rate. He only takes one insurance, and the rest are cash.
Wow. And it brings back the real nature of a transaction and a relationship, right? It's like we're doing business together, and we enjoy doing business together. Why would we have a third party getting involved in our business?
Right.
Which just seems like insurance.
That's exactly what it is, and that's what we've done at the practice. We've streamlined it. Miguel does it with dermatology. It's this amount for a visit. You pay it, you leave. There's no bills.
So your husband's a dermatologist. He also has an interesting story. He was a scientist, was it?
He was so he did electrical engineering. Then he worked at NASA. And then he worked at UPS for industrial engineering. Then he did business development for an aviation company, and then medical school. Yeah, he likes to really put himself through a lot.
At least you knew since you were 5 years old what you wanted to do. That's you went the more direct route.
Yeah.
Yeah. So what causes the distrust in medicine? Do the doctors have anything to do with this? Is this pharmaceutical companies that people dislike? Is it the insurance? What's going on? Because there is a distrust in medicine. I see it. My algorithm on social media has a lot to do with that, or shows me that there's something out there.
Yeah. Oh, we feel it. We feel it as doctors, and we personally have felt it, and then amongst our colleagues, like we're on all kinds of groups and doctor groups, and it's not hidden. It's there. Everyone says it. People would rather trust someone on Instagram that really has no medical degree telling them to drink whatever kind of algae is out there versus like me telling them, hey, you should do X, Y, or Z. And I think that goes back to that assembly line. That goes back to that restaurant where you don't feel like you're taken care of. Like we're humans. We're social creatures. You want to feel good. You want to feel like you're taken care of. You want to feel like the person talking to you cares about you. Mm-hmm. And when you're not able to feel that, when the doctor's not able to show you that they care because they're stuck in a system that's forcing them to do, this assembly line type work, it's no wonder that you leave and you're like, I don't know if this institution seems to really prioritize, quantity over quality.
Volume.
And then that gets extended to the doctor, right? And I also kind of don't know, does this guy really care about me? Does this girl really care about me? Because they haven't looked up from their computer and they just rushed me out and I wanted to talk about one more thing and they said I have to make another appointment.
Yeah, it's like the opposite.
And so how do you trust that? It's kind of like, I get it.
Yeah,
From
you don't build rapport.
I completely get it. Like, I don't blame the patients. Like, I get it. How do you trust that, right?
When I was a kid, I would see on television and movies where the doctor would make house calls. Yeah. And that seemed so genuine and so awesome that they'd show up and they'd spend all this time at the bedside. Those days are long gone, huh?
I've done it. I was just at someone's house. Yeah. Yeah, I've done it. That's really what I'm trying to bring back and what we're trying to bring back is we call it like old, the care the way it should be, the care the way it was, right? Mm-hmm. I mean, some patients that go, I remember in my time, that's actually how it was. I'm like, yeah, that's what we want to bring it back to. That's what healthcare should be. And not just the reactive medicine, right? Not just like you came to me, your shoulder hurts, let's do your shoulder. That's what I call reactive, right? So you're just fixing the problem. The focus should really be on proactive. So I tell my patients, yeah, I'm there for you. Of course, if you get sick, if you have a cough, cold, you're going to come to me. My patients have my cell, so they text me. But it's proactive. It's what are we doing to prevent getting sick? What are we doing to increase your lifespan and your health span, not just your lifespan, because I don't want you 90 in a wheelchair. I want you 90 and still traveling, right? Yeah. That's the point. So we make those long-term goals. You need time for that, right? So my 1 hour, 2 hour visits where you really get to know the patient and you create those goals for them.
And what sort of things are you advising people to be proactive? Because I'm all about that. I don't want to get sick. I don't want to go to the hospital. I want to live healthy. I don't know how long I want to live, but I want to live very healthy. So give us some of those things that you advise people to be healthier.
And this is going to sound kind of like common sense. And I know sometimes people hate to hear it, but it really does come down to the basic pillars, right? Nutrition comes down to exercise, sleep, and stress management. If you can nail down all of these, and even some of these like longevity gurus I've listened to, and I've gone to a few of the conferences, they say the same thing. They're like, if you don't have those nailed down, don't talk to me about taking a life-prolonging pill or a telomere lengthening pill, because if you're going home and eating processed foods, like this is not going to cut it. So it comes down to, number one, I tell people consistency. Right? Just doing one thing one time, that's not going to make a difference. So you need to be consistent. You need to develop a plan for yourself with nutrition, with exercise. You need to have a sleep schedule. And this is like, sleep is like the unsung hero. Like everyone kind of starts to, it's not sleep. It regulates everything from your hormones, your moods, your appetite. If you've noticed, if you get bad sleep, you want to eat. Yeah. You want to eat.
And you're going to eat
You're hungry. You wake up and you're like, you don't want to eat a salad that day. Mm-hmm. You never want to eat a salad when you're sleep deprived. I remember as a resident, doing long shifts and coming home, and there was never a time after a long shift that I'm like, I'm going to eat a salad. Like, no, I'd probably want like 4 cupcakes. It's just, that's what your body's craving. And it's not really your fault. It's actually chemical. So sleep is huge. Stress levels, mindset. I'm really big on mindset and like how you're looking at your life, how you're managing your stress, and putting all those together is really going to be the recipe. So I have, one thing I was doing when I was seeing a lot of patients was when I had really old patients that were in really great health, I started on my own just out of curiosity, asking them.
Interviewing them.
I did. Yeah. I did. I would take the extra few minutes and I would say, what do you do? Just do you have any tips? How did you get to this point, right? And it's interesting, but they all said the same thing. Different days, different people. They said, I don't eat too much. I always move. I do some form of exercise. and I have a healthy mindset. Like I have a positive attitude.
Wow. I wonder if, yes, eating right or eating not too crazy amounts, that's doable. Moving, that's doable. But what about those people? I can't relate because I think I'm pretty positive. How do they change that? What if they don't have that positive mindset? How do you make changes to that? Any idea?
I mean, yeah, there's many ways to do it. I sit with them first to figure out what's the blockage, right? There's a block, something's going on that becomes more of a mental health kind of psychology, cognitive behavioral therapy can help with this. I usually get the ball rolling with my patients depending on how deep these things go, and then I have people that I can send them to if it's a more of a psychology thing. There's a guy that I send to that does like rapid resolution for people who have had a certain trauma, and so there's all different ways you can do it. There's mindset coaches. I met with one yesterday. She's phenomenal, and so there's many avenues to approach this. What I always tell people, you have to be willing to do it. You have to be open to it and say, all right, I can change this and believe you can change this. And it's all doable.
And then show up and do
show
the work.
up and just do the work. That's the thing. You have to do the work. Yeah.
So, okay, concierge medicine, I've heard about it for a long time. You switched to doing that. What is it?
Well, it's a little bit of everything what we just spoke about. So it's personalized care. No insurance, so no hassles. It's a yearly fee. Patients have direct access to me, so they have my cell phone. And the focus is really on them. The focus is on their current health, their past health. I go through all their medical records. That's the first thing I do. I take a stack of I get all the records from all their doctors and I look through everything. Not because I'm trying to find something wrong or something that was missed, but things do get missed when you're in that kind of system, right? People that have had scans and maybe there was a lung nodule. Well, who's following up on that? I think it just got kind of lost in the shuffle because they were focusing on something else. I had another patient who, this is terrible, but she came to me, similar story to me, breast cancer, bilateral mastectomy. She was a few years out, and I said, okay, what kind of cancer? She wasn't sure. So I said, give me all your records. Let me look. I'm looking through her records, and I couldn't believe it. So I looked through them again, right? And then I still couldn't believe it. So I hired a nanny because I was like, maybe it's my kids in the background. Maybe I'm not reading this right. I hired someone. I'm like, please watch the kids for these 3 hours. I need to do this in total silence. And I'm looking. She never had breast cancer. She had a benign biopsy.
Wow. And
how she ended
surgery?
up getting a bilateral mastectomy, I have no idea, and neither does she. But the emotional impact of that, the physical impact of that, I mean, it's catastrophic, right? So something was missed. We didn't go digging into how or what or why, but it was missed, and I've found something on everybody that I go through. So it's just kind of, it's really important. That part of my assessment is important. So I do that, and then what we do is like a 2-hour in-depth, like I do a head-to-toe physical exam. We do a lot of this. Like we talk about the health history. We talk about any current problems they're having, if they've been experiencing, and then we make a plan for the future, right? So what is your goal? Some people want to lose weight. Some people, want to get a better routine for their diet, for their exercise, for their sleep. A lot of people have chronic conditions. So I manage those. I manage their medications. I try to get people off meds if I can. There is certain instances, and I tell my patients, I'm a straight shooter. I'm not, I'm going to tell you, if I tell you you probably need to be on this, then you really probably need to be on this. And I'll always explain it to you, and I'll always explain my thought process. And it's always going to be your choice at the end of the day. But if I recommend it, it's probably because you need it at that time. And I tell people, if we can get your lifestyle on track and your exercise on track and your sleep on track, and I see these numbers improve, I'm willing to back off and even take you off. So
is there more likely someone who's willing to invest in themselves and hire you as a concierge doctor? Is that person more likely to also be more compliant?
Yes.
Yeah.
Oh yeah. Yeah. They're ready. They just need
better guidance.
Someone to help, right? They need someone like one of the first patients I had came with a full body MRI that he had done, but there's no one to interpret it. So now the thing is, you can do all these tests, right? Like you can order blood work, you can go do a full body MRI. You kind of like, I've had people be like, well, we don't really need it. We're going to do it ourselves, but who's interpreting and who's putting that together? Yeah. And who knows the nuances of, hey, well, in your case, that might be, more alarming than in someone else's case because of a family history. Those are the things that we connect, right? Because of the training. So yeah, I'm able to take all that information and kind of digest it. And I always send people kind of a follow-up and say, hey, this is what this means for you. This is what I would recommend for a plan. And then there's a lot of close follow-ups, whether it's by phone, text, in-person visits. I'm always talking to my patients. I was like texting with one right before I left the office. There's it becomes more of a relationship where you're really able to, reach out to me and say, hey doc, I'm worried about this, instead of Googling. And then I'll give you like a good answer,
I'd rather talk to a doctor than Googling.
Yeah.
I wouldn't understand half the things I Google. I have friends who use a continuous glucose monitor. They don't have diabetes, but they do that to just make sure that they're tracking and that they're doing well, and to predict, I know this thing's going to make my glucose go up and all that. When you said about taking people off medication, going along those lines of diabetes and sugar, seems to me, and reading books like Outlive by Peter Attia and focusing on that myself, I don't eat a lot of carbohydrates. Wouldn't that solve a lot of problems, the sugar that's in everything?
Yeah, that's a big, I think that's probably number one, sugar, the carbohydrates, like the, white breads, white pastas, all the processed foods. I mean, if we, in my perfect world, we just cut all of that out, I think that would really, really decrease chronic disease significantly in this country. It's just so available, and it's so easy, and it's convenient, and then it tastes good, and some of it's modified to taste even better, so your brain's kind of addicted to it. So the sugar is a big issue. I like continuous glucose monitoring. I mean, diabetics, obviously, for them, they need it. I have definitely seen many people use it outside of that to track and see, okay, maybe that morning smoothie is actually spiking your sugar more than you think, or maybe a bowl of white rice would spike you and not spike me in the same way, right? So you kind of get to know. And what I like it for is proving that movement and exercise actually helps with blood sugar control, right? So you have that on and you eat, and then you go take a walk, and you're going to see that sugar controlled better than if you just sit down and watch a show after that. Yeah. And so it's nice because it really shows people, and I think it increases compliance for people who are willing to do it. Say, okay, you know what? This is really helping me, then I'm going to keep doing this.
Yeah, you're getting feedback.
You might not need you're not going to wear the monitor forever, but for a short time, just to see that feedback, I can see that it can be useful for people.
It teaches you. I read an article. I thought this was bananas, that some pharmaceutical companies are invested in ultra-processed food brands where they own them. That seems evil to me. You're going to sell me the solution for the poison. You're also selling me. Talk about a great way to diversify, great investment advice from whoever did it there. But it just sounds evil. I'm going to get you sick by selling you ultra-processed food, but then guess what? I've got a miracle cure for you. And I Googled this and read legitimate articles about it, and it was just an assumption that I had. I thought, I wonder if the system's out to get me, if people want me sick. Because I tell that to myself to combat things, to fight things off, right? Because I could tell myself, I'm going to be strong, but if I know there's an enemy, which I tell myself, there's an enemy, the system wants me sick, now I'm going to fight harder against it, right? But this is legitimate. I mean, you could Google it, you could read articles on it, and I don't know the exact names of the company, but big pharmaceutical companies investing in those processed food companies.
Yeah, I haven't read specific articles.
Does that surprise you, though?
No.
Yeah, the system's out to get us.
It doesn't. I'll just say that. No, it doesn't. Yeah. I mean, I don't know. This is why I'm doing what I can and controlling what I can. You know what I mean? And this is why I opened up. This is why I'm doing what I'm doing this way. I'd love to be able to solve this problem for everyone in the nation. Honestly, my heart is there because it really pains me to see young kids with chronic diseases and patients with chronic diseases that I know could be avoided if we're changing the food, if we're changing the fuel that we're putting in our body. And when it's so accessible and it's made cheaper and it's made to taste better, it's hard for me to fight against that. I still do it, and I'm going to keep doing it, but it's tough because I'm like, well, try a plate of broccoli. It's like it's never going to taste good as a bag of Cheetos. Right. But
somebody told me the other day, I hired a health speaker for our retreat in the Brotherhood, the men's group. And she said, eat foods that kind of regulate themselves, that tell you to stop. Mm-hmm. For example, I like vegetables. I eat a lot of vegetables, but I'm not going to eat this many vegetables, a whole bag of it. But if I ate, which I don't, but if I ate Pringles, man, I could probably knock out that whole can. Because I remember as a kid, you just can't get enough because they're tricking you. They're putting things in your brain that tell you can't get enough. Keep going, keep going. So I thought that was pretty neat. Eat those foods that automatically tell you to stop. like a bowl of broccoli, right?
Right.
You'll get full
Right.
after
You'll
a
get
certain
full.
amount.
And also stop before you're full, right? I always try to tell people, that feeling when you don't really need to eat anymore, but you could. That's the best way I describe it, because they're like, well, how do I know? I said, that feeling when you eat and you know that you could stop right there and you're not full, you don't feel sick, you don't feel overly distended, you could eat something else. I'm like, don't eat the something else. I'm like, that's the best way to, I'm like, just stop. Like, oh, that's hard. I'm like, but that's when you need to stop.
And then you get up sometimes and then you go, oh no, I am kind of full.
Yeah.
I used to eat to that point where I couldn't anymore. And when I got up off the table, the pain, the discomfort. But then now I learned to stop earlier. And when you get up, it hits you later, right? There's like a delay in how quick you feel full.
There is a delay. Depends on the food as well. I tell people sometimes start with a glass of water as well to decrease how much you're intaking if you're trying to lose weight, if you're trying to really watch your weight. But I was actually like an overeater myself. Like I would always eat to the point of being full.
But that's human nature, a terrible feeling, right? Because 10,000 years ago, you didn't find food everywhere, right? Yeah. It wasn't. There was no refrigeration. There wasn't snacks that you could open with a long shelf life. You hunted an animal and you had to eat it, right? Or you got some nuts or you got some fruit and you had to eat it. So I think we're built to want to keep eating, aren't we?
Well, I mean, I think you eat, back then they would eat to live. And now I think in a lot of ways we live to eat. Mm-hmm.
But the problem is if we have this built in us that tells us to eat, but there isn't that much food around, like in real nature, 10,000 years ago, then we would have been okay. Yeah. Problem is, we have that desire. It hasn't changed in the evolutionary path, but the food's everywhere.
Right.
And it's the worst food
And
ever.
The stress levels are higher, right? And the sleep is worse. So there's a lot of factors. There's a lot of factors that are coming into people's lives, in terms of just scheduling, the amount of, things that we're cramming into a day, the amount of input we're getting from emails, from text messages, from social media. That is all stress. It's stress that we don't count it as stress, but I think it all adds up. And it creates something in us that makes us, and a lot of people are emotional eaters. They feel like, they feel a release from eating. And I think it leads to more eating and more snacking. And then you have the food available. It's, it kind of makes sense why that's happening.
Of course. Someone told me the other day, my buddy David Rothenstein read this in a book and he shared it with me last week. And I think he's right. He says in nature, we went to a charity event a couple weekends ago and we had to walk through the casino. And I don't like casinos because I don't like a lot of noise and I don't like a lot of stimulation, like cigarette smoke, lights, a lot of people talking, and the machines making all that. That just bothers me. And for 18 years, I went to trade shows where I went through casinos all the time in Vegas, and it always stressed me out. And he said, you know why that's causing stress for you? Because he read this in a book, that nature is very quiet. The way we were intended to live is in nature. It's not very noisy in nature, right? There's no artificial noises. Yep. There's not that many people. Now there are. But you're right. When you're looking at social media, you're looking at television, you're looking at all these things, it's constant inputs, and that probably...
we're overstimulated.
Yeah.
We're overstimulated, and I don't think our brains are built for that. We've pushed them into that, and we'll continue to push them into that, but they're not.
Yeah.
They're not. And some people feel it more than others. Like I actually know that I need those retreats, those nature retreats. Like I can sense a complete difference in myself. Some people respond well to that, but I think overall the stimulation needs to be dialed down. I don't know if that's the direction we're going, but even for sleep, like I tell people for sleep hygiene, that's one of the biggest tips is no iPads, no phones, no screens for, at least an hour if you can do 2 before bedtime.
Yeah.
Because of that stimulation and actual light hitting the eye, telling our brain that we're supposed to be awake, keeping us up, and then you can't sleep or you're having interrupted sleep. So that's actually part of sleep hygiene.
Yeah.
Is to dim the lights and
down.
Go into a, what do they call it? Not turn down. What's that name?
That winding down.
Down. I don't know.
Yeah, I don't know the name. I saw a sleep documentary once, and it said that the invention of electricity has destroyed humans because when the sun would go down, at most you start a fire. That was it. That's so calming,
right?
And it's relaxing, and it's a small dim light, and that's how we were meant to be. And people would sleep like 10 hours a night. Humans, like everybody, because there's nothing else to do. But now you have a light bulb on. That in itself, a light above your head tells your brain that it's daytime.
Right, and you're waking up with an alarm clock, and it's like I've said it because I had a hard time waking up like the past few weeks, and I'm like, this is unnatural because it was dark out. Mm-hmm. I told Miguel, I'm like, this just feels unnatural. I was like, it's just pitch dark outside, but I also went to bed too late, so I was too tired. So that's what
you're
you said.
Stimulated by more lights.
You're stimulated, but Yeah, one of my favorite things to do is when I can just go outside in the morning and like get the fresh light hitting me. Like I'll have my tea out there and
wakes you up properly.
It's more calming. It feels good. It feels like a good transition to start the day. It doesn't. I can't always do it. I have two young kids. It doesn't always work out perfectly, but I try when I can.
Next, in a few weeks, I'm going hunting in Idaho in the mountains with my buddy Chris Williams, and he told me that when he gets out in nature, and he goes out, and he's a real woodsman, and he lives out there. He's been doing it since he was 15. He'd tell his mom, I'll be back in a few days at age 15 and be gone for days and hunt his own food and everything. He's a real outdoorsman. And he told me that when he goes out there with no technology, if he dies, he dies. Nobody's going to find him. It's about day 3 that it just starts shutting down, and in a good way. Like, all the noise gets out. He says he still feels like he hears noises, like, all the technology, maybe the radio waves. I don't know what's around. The phone in his pocket. When that's not there for 3 days and he's just in nature, he says, like, it's and most of us won't experience that, right? I mean, who goes 3 days in nature without
I'd love
a phone?
to do that.
Yeah.
Like, I'd love to. Miguel's going on a trip to the Everglades. It's 4 days.
Wow.
Yeah.
Wow, that's rough.
I think that's going to be great for him. We're all about that. We really love to shut it down, and really, my dream is I told my family, I'm like, we have a big family, and I said, one year, especially with the holidays, it starts to get this way where you're just like, there's too much of everything, right? I'm like, can we just take the whole family to a cabin somewhere with no internet? That's what I said. I'm like, with no internet and no phones, and we just are together for a week.
Yeah.
With just whatever we have there. Like, that's my dream to do that. And because I really think that's necessary for everyone, from the children to the adults.
Yeah. My 12-year-old daughter, she would hate it if she knows I'm saying this about her, but she has a phone now because she, we have to pick her up from gymnastics. She has to call us. She's at a friend's, so she has to call us. So she has a phone, and I've told her, if this keeps happening, the rules are really going to change. I don't see her unless there's a phone in her hand. And oftentimes she's looking at it, right? The other time she's holding it because she's going to look at it. And I can't imagine at 12 years old. I mean, that didn't exist when I was 12, at least. Nothing like that existed. But it's just become a part of them. It scares me to think what happens 20 years from now.
Right. I mean, and my dad would probably hate if you heard this, but I'm pretty sure he's addicted to TikTok.
Oh, your dad?
Yes.
Wow.
Yes. And when I tell you, when he showed me where he grew up, it was 4 walls and a slanted roof and a pot in the middle of in the middle of the floor. Because I remember I asked him, I said, Dad, why do you eat so fast? He really just inhales food, right? And I of course, I'm into all of this stuff. So I'm like, it's really not good for you to eat that fast, Dad. And he's like, and then when he showed me, he took me back to Montenegro. He took me back to his village, and he showed me, and he said, look, this is where I grew up. And I walked in, and it was just a pot in the middle of the house. And he said, we had a spoon. And
he had siblings?
Yeah.
So it's eat or starve.
Right.
You got to hurry up.
Like, you eat and, whatever. Everyone ate from that pot. And he's like,
wow.
So I'm like, okay. I felt bad for coming down on him. I'm like, all right, I get it. Maybe, just ingrained in you.
So how does he go from that
How do you
TikTok?
go from that to being addicted to TikTok? Like, my sisters and I talk about it. Like, he doesn't put the phone down. He even sends me, I don't have TikTok. Yeah. So he sends me stuff, and he's like, did you see the TikTok? And I'm like, Dad, I can't open it. I don't have it. And he's like, oh. Kind of like, what's wrong with you,
Catch up with the times.
Right. So it's like, for someone, and that's my point, is like, then what are we going to expect from the kids? Because they're born with this stuff.
Yeah.
If they can get my dad, who came from eating from a pot in a village to being staring at this thing all day, even when we're around family, where we have to sometimes be like, hey, can you put that down? Or my mom's like, whatever. But
is your mom addicted to it?
No, my mom's not that. No, my mom's about the eating well and exercise and the family and the kids, and she's too busy. She's always cooking or cleaning or doing something.
It's funny. I'll tell you this. My dad was in a labor camp in Cuba, where I was born, and forced to work and all that, and born in the 40s. So was my mom. But here, we'll have a family party. It'll happen probably this weekend. And after an hour or so, the food's done, my parents disappear. And we might be out by the pool, we might be in the dining room, but my parents go to the living room, and when you look over, they're not even talking to each other. They're on Facebook. That's their
thing,
their thing.
Yeah.
And it seems to me like they're on it more than I am. And they're in their 70s.
Yes.
So yeah, you're right. It's affecting everyone.
It's kind of, and it's weird. It's weird for me when I see it. Like, it bothers me when I see it at restaurants. I know it's become so normal now, so it's just, whatever. But it kind of like pains me. It's like, I'll see like a couple sitting there, and they're both just on their phone, and then the food comes, and then they put it down and they eat, and then they finish, and they both just pick up their phone. Like, whatever, maybe I'm creepy, but I'll like watch.
Me too.
Like,
I watch that too.
I'm always watching.
Yeah.
And I'm like, they haven't spoken. They didn't
Yeah.
speak one word the entire time from the time they sat down.
Yep.
And then they left. And it's just very strange to me. I'm like, what's the point? Just order food, sit at home and watch
why
something.
come to the
why even
experience
do
of
this?
being at a
It's
restaurant?
really weird. But it's so socially acceptable that like I don't even feel like I can actually say that to a lot of people because
what are you gonna say?
I'm going to be weird, you know? No, not say it to them, but even like
Right.
say it like this and say,
No, I get
don't
it.
you
You're
think
talking
that's
to-
strange? I feel like most people would be like, no, what are you talking
So
about?
in
You
our
know?
family,
So it's like, can't even talk about it anymore.
No, well, we've maintained one thing. I'm pretty strict. And while I haven't cracked down 100% on my daughter has rules like you have to bring the laptop and the cell phone into our room at a certain time every night. It's 9:00 and it's over. At dinner, no one's allowed to have a phone, myself included, my wife, our 4 kids. Nobody can have a phone. That we've maintained because I find that disrespectful. We're all here enjoying dinner, talking, and one of them's looking at a phone. It's like, you hate us. That's the way I see it.
Yeah, well, we started that as well. Miguel and I started that before we even had kids.
Good.
Just with each other.
Yeah.
Like no phones when we eat.
Yeah.
Like, even if we're not talking, that's fine. But
Yeah.
we're not looking at phones. We're not checking emails. Like nothing's that urgent for that, short amount of
course,
time.
just
and
for a
we've
little while.
maintained that.
And those are the memories we build. I'll tell you this, having now my oldest are 19 and 17, and they're busy. They're very busy. My son's in the Army, and he goes and comes. And for us to have all 6 of us at a dinner table now would be an absolute gift.
Yeah.
And it rarely happens now. So I hope people listening take advantage of that, especially if they have young kids. I promise you're going to regret it when they're gone, that you didn't do more of it, just to be all together. The other thing is, you said about restaurants. I notice those things too, because it drives me nuts, and I have the exact same thought process. But on top of that, I see often families of 4, and the 2 kids have headphones.
Yeah.
So they're not learning from conversation. And then they have an iPad in our house, or whatever, a tablet. Our house, we never had a tablet. But I learned so much at the dinner table as a kid, because my dad and mom would talk. They'd encourage us to, they'd incorporate us in the conversation. If we had a guest over, those were huge learning times because an adult was there. And now I got to see my parents interact with an adult.
Right.
And I got to learn how adults talked. And they asked me questions, and I got to mature at a good level.
Yeah.
These kids nowadays, they don't know how adults talk. They're closed off from the world because they have headphones on. So they don't hear any conversations.
Right.
Yeah, I find that sad. And to hear, but I like how you connected that's causing, I really like that. That's causing the stress, which is that's probably leading to illnesses.
That's
and
stress
more
on
problems.
everyone. I think they've done studies that just looking at social media for I don't know how long, like actually makes people feel worse about themselves. Teenagers nowadays, I mean, we see it from the derm side that are coming in that, want perfect skin. They want their skin to look like it's a filter because they're using a filter. It's not real. So that the lines are getting blurred between what's real and what isn't. Communication, like you said, I feel like I called someone yesterday and I said, I hope you don't think it's weird that I call, but I'm a caller. I like them. She was just like, I actually like it, but you could tell like nobody's really done that. Like she said, she even said most people just text and we text back and forth. And she goes, I've always thought it's kind of annoying because we're just doing these long text chats. Why not pick up the phone? And I think that goes back to what you're saying is learning from adults, hearing the world around you, even if you're not being spoken to directly, right? But hearing that, and the iPad thing it's tough. I mean, I have 2 young kids. They have iPads, but I try, and it sometimes feels like it's just this battle that I don't know if I can win. Like I've taken them to a restaurant. I vividly remember one time I took them to a restaurant in Miami with 2 of my girlfriends, and I took both kids. And I brought a backpack of toys and things for them to write and all things to switch it out, right? And they were doing really well. They were coloring. I had like these magnet things, whatever. A family showed up with 4 kids. They put the kids down. They took the iPads out. There wasn't any talking. There wasn't even the kid like requesting the iPad. It was just like Automatic. They put the kids down. iPad went up, got plugged into the headphones, which was shocking for me, the headphone thing. Like it plugged into headphones, sat them down, and I mean, the adults had a great time because I honestly did not have to. They put the food in front of them. They didn't have to feed them. It was just them having two separate types of two separate lunch. And what happened? My kids, right? So they're playing with the toys. Now I see my daughter. My son was too young. My daughter starts to kind of peek over.
Oh, because
right?
this is
so
with you.
They're at the table. They're at the table next to us. So now she's peeking over. There's a girl there, probably around her age, locked into an iPad, and of course it's visual and things are moving, so you're naturally looking. And now I see her looking. I see her looking some more. I don't know, she's getting bored with what she's doing. And inevitably turns to me and goes, can I have my iPad? And it's tough, you know, because it's like, and that's what we're seeing most of. It's the same thing with the cell phones and all that. It's like, what do you, I don't want to give them a cell phone until they're 17. Good luck.
Yeah,
like, good luck. It's the same, it's the same concept, you know, so unless you find people that are like within your realm of parenting and you guys all do it the same way, which I really want to try to do.
Yeah, you know, form that community.
And have that community where I had a patient who said that. She told me, she said that all her kids, like all the parents of all the kids hung out together. And they all kind of had this group where they talked like this. And they said, all right, this is how we approach parenting. This is what our ideas were the same. So that when your kid came to my house, I would parent them. And guess what? They probably listen because, you know, they always listen to the other parents more, right? Yeah. That's how it always was. Like my dad hated that. He'd be like, I told you this. And this person's mom, you know, I'm like, you know what Mary's mom told me? And he's like, yeah, I told you that like 50 times, but okay. And so that's what she did. Intentionally, they did this. I think they were in a small town. And she said, you know, when Mary's daughter came over, like I parented, but they were parenting the same.
Yeah, that works.
And they created this little bubble.
Yeah. You know, in the book, The Comfort Crisis, it talks about the necessity for boredom. Boredom was a good thing. I was bored a lot as a kid. Yes. I didn't have cable. I never had it. So I had the antennas with a very limited amount of channels, which was kind of good because I watched a lot of documentaries on PBS and I learned as a kid. But you get bored. There comes a time where there was nothing to watch because out of the, 8-9 channels, whatever I had, it wasn't enough. And I'd just sit there and I'd play with my cars. Right. And then I'd figure something out. I'd go get my baseball cards and I'd do 20 different things. Like, okay, now I'm going to put all the red ones over here, the blue ones.
Yes.
I mean, I just
random sorting. Just random stuff. Yeah.
And
that's how I grew up too.
But a lot of boredom.
Yeah.
And I remember sometimes telling my parents, I'm bored. And they'd go, well, that's not our job. And I'd just be on my own. And it's funny, parents are scared, I think, of their kids getting bored.
It's just making me laugh because, you know what Miguel said? His daughter said, he has an older daughter, and she was like, I don't know, maybe 7-8 years old. She's like, I'm bored. And he goes, yeah, boring people are bored.
Yeah, that's right.
That's it, Miguel. And he goes, that's it. Boring people are bored. Go find something to do, you know, because we were both raised like that, too. He would spend summers in Spain, and I was in the Montenegro. And actually, I just found out not too long ago that we didn't have toys growing up. Like when I was in Montenegro, we had a different lifestyle there. But when we came to the States, 4 girls, and I called my mom one day and I'm like, Mom, did we have toys? Because like, I don't remember playing with toys. I think it was a moment where I was like fed up with the amount of toys that I had in my house with the kids, and they were still like somehow not able to get it together and go do something. And I'm like, what is going on? Right. And I'm like, I don't even remember having toys. And she's like, no, you didn't. She's like, at that time we like couldn't afford it, and it was just you 4, and you guys would just play with each other, and that's what you did. And I'm like, so we didn't have toys, but I have such fond memories of my childhood. I have such vivid memories of having fun that it was shocking to me, because I'm in this, you know, I've kind of got caught in this trap myself a little bit of like, oh, they need a new toy. Right. They're bored, and I didn't have one. We would make up games. We would play at the park. It's a little bit of a different time. We could play outside in the park until she called us in to eat. I don't know if I would feel comfortable doing that nowadays. Right. I guess depends where you live, but we just figured it out and made it up, you know? And you used your brain. You're more creative. Yeah. I didn't have toys either because we came to this country and I was a kid and we couldn't afford them. I remember having a plastic yellow wiffle ball bat, a baseball bat with plastic wiffle balls. And that was the entire day all summer. That's what we would play with. And we had so few wiffle balls, probably had 3 of them. If one got lost in a tree, we found it. Yeah. My brother and I and our friend would find it because we only had 3. As opposed to, I got so many toys. Figure it out or go buy another one or something like that, you know? Yeah. Like just the other day, like Aiden, my 3-year-old, I was really shocked to hear this because we don't have this philosophy of like, oh, it's broken. Oh, we'll just go get another one. So it was shocking because he likes Pikachu, and I got him like a ceramic Pikachu, a little coin jar. And he broke the ear off. Oh, you knew that was going to break. Ceramic at 3 years old? I know, but it was cute. And I'm like, all right. I told him, be careful. He broke off the ear. And he's like, okay. He's like, it's okay. He's like, we'll go get another one. I'm like, we will not. Yeah, no, glue it. I said, we will not. And I said, you have to fix it. And he looked at me and I'm like, you have to fix it. And usually he was always saying he has to fix it. So it was kind of shocking he said that because he's a fixer. He must have heard it. And he's like, oh, we'll just get another one. I'm like, no, we won't. Got super glue and like, you know, showed him. I'm like, look, we're fixing this. Right. And then you're going to take care of it. And guess what? He hasn't broken it since. Yeah. He's carrying it around the house. He's being careful. He knows that it can break. He knows what it means for it to break. That's such a good lesson. And now he has it and he's asking, okay, we do coins in the jar. And
Good.
But yeah, that's what we always do. We're like, fix it, you know?
Oh, that's fantastic. All right. So if someone is in South Florida, it's easy. They can hire you as their concierge doctor. You have a physical location.
Yes.
You're in Fort Lauderdale?
Fort Lauderdale and Broward Boulevard.
Okay.
Yep.
And is it, okay, that's for Broward Boulevard and what?
So we're 800 East Broward Boulevard. We're in the Cumberland building, right by like close to US 1.
Okay. Yeah.
Yep.
And what if somebody doesn't physically live here? Is there a geographic limitation to how they can contact you and work with you?
There isn't. I mean, I do telehealth. It becomes tricky with licensing. You know, so I have a Illinois license. So if anyone's in Illinois, I can see them and I can prescribe to them. I do like to see people in office at least once a year. That's a minimum. Why? Because I like to do a physical exam, which is completely fallen by the wayside. However, I believe in it. I've caught things on people that were completely asymptomatic. In fact, I had 2 very healthy men in their 40s with no symptoms that came for an annual checkup, that both of them ended up having atrial fibrillation, which is an abnormal rhythm of the heart that leaves you at a very high risk for having a stroke. And, you know, they both ended up having different courses of treatment, but
and you find that by listening to the heart?
Just by listening to the heart. Wow. And there was 2 in 1 week. So that was one of those things where I'm like, it sticks with me. And I found other things. I found a lot of thyroid nodules, thyroid cancer in one lady. So you'd need to do the physical exam. So I tell people, if you can come down, even if you don't live here, but at least once a year, like come in the office, let me do a full head to toe. Let me make sure we have that documented. And then after that, I can do a lot of telehealth. I did only telehealth for 2 years. Wow. In between like the corporate medicine job and what I'm doing now, I did telehealth during COVID. So there's a lot I can handle virtually. But
so if a snowbird is down here in Florida in the winter, and they live here in the wintertime, but then they head back up in the summer, you could still prescribe to them?
I could still do that, especially if they're seeing me in the office here. If there's enough documentation for me to say, hey, you know, they're here, they have an address here, I've seen them here, and let's say they're up there and they, you know, need something, or I think I need to prescribe something. The only thing I can't do is prescribe controlled substances across state lines. That's just a regulation, but I don't tend to do a lot of those. I have the license. I don't tend to prescribe a lot of it, though.
Sure. I'm with you on those physicals. My wife, when she was 15 years old, went to get a physical for a field trip for school. And I think it was like a mono test or something. And they found thyroid cancer. And had surgery. Years later, they found more cells, so she had to radiation and stuff. But by then she was visiting an oncologist after her surgery. So just from the doctor feeling and thinking something was wrong, sent her to an oncologist and found thyroid cancer.
Yeah, it's huge. And I have people that are like, I haven't had this done in 20 years. I'm like, well, have you seen a doctor in 20 years? My first question, yeah, I have. Mm. But that's, again, it goes back to the assembly line. You have 5 minutes. What kind of exam can you really do? Yeah.
And plus, it's reactionary
it's reactionary, right?
You don't have any symptoms and they don't.
Right, exactly. Like, your arm hurts, so I'll just look at your arm, but you could have something else going on. So I'm a big believer in it. It has to be there. That all of it has to be there. The physical exam has to be there. The mental health talk has to be there, right? If you're not doing well mentally, you can end up with I see a lot of aches and pains, a lot of GI, because there's a big connection between the gut and the brain. So people are coming in with just kind of these non-specific symptoms. And all these workups are being done, and that's fine. We can make sure that it isn't X, Y, or Z, but no one's addressing the mental health that's actually fueling it in some cases, right?
This is a whole different conversation. We don't have to get into it, but I highly believe I'm a live below your means type of guy, like way below my means. And I find people stressed out, but they're worrying about getting the next model of the new car, the bigger house. They're constantly driving themselves to get more, and then they're stressed out and sick. And they don't see that connection. But anyway, we could do a whole.
Yeah, that's like a whole, I think, I agree. And I see that all the time. It's almost like, I don't know if we're wired that way or if we've made ourselves that way to want the next step and to forget how far we've come, right? To forget, to look back and say, like, hold on a second. Yep. We were here. Look at where we've come from. Look at what we had before. You almost forget that. And you're like, well.
Because we're taught to focus on the opposite. We're taught to make a vision board. And, look how life could be so great. And that's how I want it to look. Right. I have done those with my wife in the past years ago, but I also have something that's the opposite. I have a picture of the house I grew up in Cuba. Yeah. And if you saw it, it was bad. It was really sad to look at that picture. But I have that picture because that's my reminder of, oh, man, look where I'm at now. Right. And that feels good. That gives you gratitude, which I think is a shortcut to get happy.
I think so, too. Actually, I think so, too. And more I'm starting to believe in that and really, and really like, not just saying, yeah, I'm happy I have this, but really like sitting in that moment for a second and saying, I actually did it this morning. You know, I was like, thank you. Like, thank you for like my family. Thanks for waking up. Thanks that I don't have cancer. Thanks that, you know, I have 2 beautiful kids. Thanks that I'm able to do this concierge and like, and help people. And just thank you for all of this. Right. And then you just feel so full. Like you feel like you're like, all right, I have so much and so much more that, and so much that many people would maybe are striving to have and have on their vision board, you know? And I think that the one advice that I give people is like, water the grass that you have, you know, like water, like don't always look at the whole grass is greener mentality. It's like, sometimes in life you require to do a big shift, right? Like there's just things that are just non-negotiable and you need to get out of a relationship or something like that. But a lot of times I feel like we're just so, we're so quick, right, to dispose of everything, dispose of toys, dispose of people, you know, it's just like, well, that's not working. Oh, we had a fight, let's break up. It's that's like, water the grass, pull the weeds. Yeah. That's what I actually said that to someone. I said, just pull the weeds, unless it's something, like again, a massive issue that you can't overcome. Pull the weeds and watch things grow on your side. It's not always greener out there.
Oh, yeah. And it starts with yourself. You know? If you want that marriage to be better and you're not coming in as the best version of yourself, let's start there, because that's the part you can control. That's the part and then you show up better. You should level up the next person. Yeah. All right. So do you have a website?
We do. We have what's called, well, if you type in galtdermatology.com, it takes you to our website, which
GALT?
GALT dermatology.com.
Okay.
And it takes you to us. And
that's your husband's dermatology practice?
It's both of us. It's just that's the name of the site. Okay. But it ends up being, it's our website. So it has the dermatology arm there and it has the concierge arm there. So you can get information on both aspects.
Galt dermatology. Yeah. All right. Well, we talked a lot more than just concierge medicine.
I love it.
More than what you do. Yeah. Just a lot about life. And, it's some of my favorite topics as well.
Yeah, me too.
Thanks for joining me.
Thank you for having me. This was great. Likewise. Thank you.